Welcome to today's lesson, Getting Help with Iodine, a guide to working with your doctor. This presentation is being made available for those who want to use iodine but don't feel comfortable embarking on this journey alone. I've put together some information that can be shared with your healthcare professional that will help to guide you on this journey. Please note that this information is not all-inclusive and assumes that the doctor knows how to appropriately identify issues that may arise from suggested lab tests and that he will have the skills to address them. This is not a practitioner training program. It is a guide to getting you started on the path to supplementation. My name is Stephanie Beist, and I'm a naturopath and certified health coach. I've been studying iodine since 2006 when I began using it to assist in my own healing from papillary thyroid cancer. It changed my life so much that I became passionate about sharing and helping others. Before we begin, I need to share this disclaimer. This presentation is not meant to be medical advice. It's an educational presentation that shares my observations from over the years in teaching others on their individual journeys of iodine supplementation. It's not meant to diagnose or prescribe protocols or products. The intended purpose is to give you the tools to use when discussing your own medical needs with your healthcare professional. So this is a short outline of this discussion. We'll go over the issues that may warrant considering iodine, what lab tests you should ask your doctor to run and why, the iodine loading test, should you do it. We'll talk about this importer dysfunction test, what it is and why it may be needed. How are your adrenals? Can your liver be an issue? What's next? And where do I start? This list represents some of the common health struggles that people are dealing with today. They're also the diseases that seem to be closely tied to an iodine deficiency and are greatly improved when iodine is added. Many can also be tied to a low thyroid condition, which can improve by the addition of iodine as well. Please note that I have placed an asterisk next to the word nodule. There's a specific type of nodule called an autonomically functioning nodule. These nodules are rare, but should be considered when seeking to supplement with iodine. They can only be diagnosed through the usage of radioactive iodine scanning. Lab tests alone will not identify them. You may have a clue to look for them if you're hyperthyroid and have nodules. An autonomically functioning nodule will create thyroid hormones without the stimulation of TSH. In a normal thyroid hormone creation process, the TSH tells the thyroid gland to produce or not produce hormones. With these nodules, they do not respond to TSH and will produce hormones and run without a limiting regulation. If you're diagnosed with this type of nodule, then iodine is contraindicated and should not be used. This slide represents additional health concerns that have shown improvement by the addition of iodine. The scientific research that I found over the last 11 years has been amazing. Old Merck manuals and Materia Medica give a window into learning about the usage of iodine in a historical medical practice. I'm reminded of the rhyme that Dr. Abraham was taught in medical school that he referenced in his own lectures. If ye don't know the where, what, or why, prescribe ye then K and I. You see, they didn't have a huge pharmacy of synthetic drugs at their disposal in the 17 and 1800s, but nutrition and herbs. Cysts, for instance, were always covered with an application of iodine, and in some cases they were drained and then injected with an iodine solution. It worked amazingly well. Sadly, this art of care is lost in the pages of the now deteriorating medical books. One of the objections you'll need to overcome with your doctor is probably their misguided understanding that the thyroid gland is the only part of the body that requires iodine and that 150 micrograms is sufficient for health. This value of 150 micrograms is the RDA, or recommended daily allowance, which was set by the government as an amount that avoids goiter formation. But we know that the body requires much more. When fully saturated, it will store up to 1,500 milligrams. Research shows that there are approximately 700 milligrams in the fatty tissues, 650 milligrams in the striated tissue, and 50 milligrams in the thyroid gland. Every organ, gland, and tissue concentrates iodine or iodide. This is why you want to supplement with a solution that has both forms to ensure that the body receives both types that it needs to maintain optimum health. We began this presentation with a list of issues that may have led you to investigate supplementing with iodine. There are other beneficial reasons that you and your doctor may not realize. Other than the obvious prevention of goiter and increase in thyroid function, we also have a very important benefit for everyone. Iodine is needed in a process called apoptosis. Apoptosis is programmed cell death of abnormal cells. Our body is constantly eliminating mutated cells. With a properly functioning immune system that includes apoptosis, we're able to keep things in balance. Iodine is also important in blood sugar issues. It helps to sensitize the hormone receptors such as insulin and sex hormones. Dr. Fletches has reported success with patients who were able to reduce or eliminate their usage of insulin after taking the iodine protocol. So if you are on blood sugar or insulin products, you and your doctor need to closely monitor your levels. Iodine detoxes not only bromide and fluoride, but also mercury and lead. Patients who have suffered from chronic fatigue and fibromyalgia have found increased levels of energy and reduced pain. This may be attributed to the increase in thyroid function as well as the saturation of the muscle tissues with iodine, since the striated tissue is a large storage area in the body. If you've enjoyed this preview of Getting Help with Iodine, you can register to view the course in its entirety on Teachable. A link to the course can be found on steppingstonesliving.com/courses, or you can select Iodine, then Courses from the menu. I offer an additional course called Iodine 101. This course covers the basics of iodine. I share the history, types of iodine, why it's needed, and some of the historical uses in medicine. I also cover the iodine protocol and how to get started on your supplementing journey. Please visit this channel again for future courses that will be offered to help you on your supplementing journey. Thank you and have a great day.